Hello, this is Dr. Sreekanth, working as a consultant medical oncologist in Omega Hospitals, Guntur. This year, February 4th, is celebrated as a World Cancer Day. This is the international day. It is an important day in our global health calendar, and the main campaign theme of this World Cancer Day is I am and I will. And this campaign theme is for 3 years, about 3 years. 2019, 20 and 21. The main target behind the World Cancer Day theme is to reduce the number of premature deaths of cancer by 1/3 by 2030. And behind this theme, I am and I will, it's all about you and your commitment to act. In India, there are so many risk factors to develop the malignancy, and most of them are modifiable risk factors. Among these, the most common one is smoking and tobacco products, followed by obesity, followed by dietary habits and lifestyle modifications, and diabetes and hypertension. Smoking is the biggest risk factor. So smoking causes so many malignancies from head to top to bottom, and which includes main common malignancy from the smoking is oral cavity malignancies and lung malignancies. And we have to encourage every smoker to quit the smoke. And obesity is other risk factor. If you take most of the Indian females and most of the Indian men most of them are obese, and we have to ask them to change the lifestyle, and we have to ask them to reduce the weight. And diabetes it causes the pancreas malignancy, so we have to control that diabetes and hypertension. And mainly diet has the biggest impact on the malignancies, and we have to encourage that diet. We have to give most of the antioxidant diet. So we have to follow Atkins diet and antioxidant diet. We have to reduce that. We have to encourage that patient to take less carbohydrate diet and more protein diet, more high fiber diet. We have to ask them to stop to take the avoid red meat and non-veg proteins. So as an oncologist, I want to focus on this here. We have to explain the disease to the patient in detail, and we have to explain treatment protocols, what we are following and what are the guidelines, and we have to give the options of treatment options depending on the financial constraints, and depending on the disease status, and depending on the performance status, and that leads to we give better healthcare to the patient. Thank you.